Food signs in radiology. Certain diseases show classic radiological signs that resemble various types of food items like fruits, meat, vegetables, eggs, bakery, grocery and confectionery items. These food signs are easy to recognize and allows a confident diagnosis on the basis of imaging findings alone, or can narrow down the differential diagnosis. Miliary shadowing. The term miliary comes from millet seed, popular birdseed. On the chest radiograph, a pattern of diffuse, tiny, well-defined nodules of 2 to 4 mm in size is called miliary shadowing. This pattern is often seen with pulmonary tuberculosis. The other differential diagnosis of miliary shadowing includes fungal infections, inhalational diseases, sarcoidosis, eosinophilic granuloma, and metastatic disease, particularly from thyroid tumors, melanoma, and choriocarcinoma. Honeycomb lung. The radiological appearance of the lungs in various conditions may resemble honeycomb. Honeycombing refers to an advanced stage of fibrosis in which normal lung parenchyma is replaced by cystic spaces of 5 to 10 mm. This is visible on chest X-ray as well as on CT scan. Honeycomb shadowing is a particular feature of histiocytosis X. The other common causes of honeycomb lung include pneumoconiosis, sarcoidosis, fibrosing alveolitis, scleroderma and rheumatoid diseases. Eggshell calcification. Shell-like calcification of the walls of hilar or mediastinal lymph nodes may be seen in few cases of silicosis, sarcoidosis, following treatment of lymphoma, and occasionally with advanced pulmonary disease. The chest X-rays may show eggshell calcification resembling egg's wall. Popcorn calcification. Popcorn calcification appears as amorphous cloud-like, resembling popcorns. This is seen in chest X-rays in up to 30% of pulmonary hematomass. This type of calcification also occurs in cartilaginous and chondroid lesions. Cottage loaf sign. The MRI appearance of the partially herniated liver through the ruptured right hemodiaphragm may resemble with the traditional bread prepared in England, cottage loaf. Hamburger sign. Normally, at axial CT, the vertebral facet, apophyseal, joint space looks like a hamburger. When the facet joint is dislocated, the articular facets become uncovered, or naked, also called naked facet sign. This CT sign is characteristic of a flexion distraction injury and indicates severe ligamentous disruption and spinal instability. It may be either unilateral or bilateral depending on whether facet dislocation is unilateral or bilateral. Champagne glass pelvis. In achondroplasia, the pelvis is small, its diameters are reduced and the pelvic inlet resembles a champagne glass due to abnormal softening of the bones. Onion skin periosteal reaction. In an aggressive bone lesion like acute osteomyelitis, Ewing's sarcoma or osteosarcoma, the successive deposition of periosteal layers gives a lamellated or onion skin appearance on plain films. Dinner fork deformity. In Cole's fracture, the distal radius is fractured and angulated dorsally, giving rise clinically and radiologically to the dinner fork deformity at the wrist. This has typical resemblance to the dinner forks. Sausage digit. Sausage is a minced and seasoned meat stuffed into cylindrical case of animal tissue, frequently eaten in Europe. The term sausage digits refer to the clinical and radiologic appearance of diffuse fusiform swelling of digits due to soft tissue inflammation from underlying arthritis or dactylitis. The most common cause of sausage digit is psoriatic arthropathy. Other causes include osteomyelitis, sickle cell anemia, sarcoidosis, and tuberculous dactylitis, spina ventosa. Licked candy stick appearance. The term licked candy stick appearance refers to tapering of the tips of the metacarpal, metatarsal bones or phalanges. The tapered bony tips resemble the licked candy. It is usually associated with psoriatic arthropathy. Occasionally, It may occur in rheumatoid arthritis and leprosy.